Good morning. Thank you all for being here. We're gathered here today to speak about a rapidly escalating crisis, one that threatens the health and safety and lives of every Pennsylvanian. Our emergency medical system, a vital pillar of public safety, is teetering on the brink of collapse. Let me be clear, EMS in Pennsylvania is failing, not because of lack of courage, dedication, or skill from our paramedics and EMTs, but it's a systematic failure to support them. Every day, EMS professionals respond to emergencies under intense pressure and dwindling resources. Behind the scene, the reality is grim. 52 ambulance services and squads have closed in the last 29 months. 12 in the last 8 months. Let me say that again, 12 in the last 8 months. If you add QRS services in, that number goes to almost 100 in the last 29 months. And many more are hanging on by a thread. The crisis is not only undermining patient care, it's also crippling recruitment. Who wants to join a losing team? No one. Among the three core public safety services, police, fire, and EMS, EMS by far is the most cost efficient for taxpayers. That's because EMS historically has operated under a user fee model. Patients are billed directly for services. Unlike police and career fire departments, which are funded through public tax dollars, EMS has been left to fund itself. This outdated model has created a dangerous perception that EMS is self-sustaining. It's not. The EMS reimbursement structure was designed over 40 years ago, and it has not kept pace with inflation, medical advancements, or the revolving role of EMS in today's complex healthcare landscape. It's time for an overhaul. The fact that EMS bills for service has become a liability. Many lawmakers and municipal leaders mistakenly believe that EMS is profitable and can survive without significant public investment. In truth, most EMS agencies are operating a loss. They urgently need adequate and consistent reimbursements. They need a stable public funding mechanism to ensure 24/7 readiness, a dedicated EMS grant program to support capital investments and medical advancements. Right now, inconsistent and inadequate insurance reimbursements are strangling EMS providers. For many emergency calls, agencies only receive a fraction of the actual cost to provide the care, and this is simply not sustainable. You can't run a life-saving service on payments that don't even cover the cost of the fuel to reach the patient, let alone the wages, training, and equipment. Commercial insurance plans are especially problematic. Insurers frequently underpay, betting that the patients won't appeal. Patients are often burdened with excessive out-of-pocket expenses, essentially penalizing them for calling 911 in a moment of desperation. Worse still, the insurers then send the payments directly to the patients rather than the EMS providers, a practice that has cost Pennsylvania's EMS system millions of dollars in lost revenue. In my agency alone, this practice costs us over $250 million in revenue annually. That money could be going towards saving lives. Municipal funding is almost non-existent. Out of Pennsylvania's 2,560 municipalities, only 28% provide any type of funding for EMS, and just 15% contribute more than $10,000 annually. EMS is often excluded from local budgets altogether. Even as we continue to answer the call, most agencies turn to raffles, dinners, donations to keep their ambulance services running. That's unacceptable in 2025. People are dying, and we cannot attract qualified providers when the system is clearly broken. EMS is consistently lumped into joint grant programs with fire departments, but we only receive 12% of those funds. It's not equitable. EMS handles more than 10 times the call volume of fire services and operates ambulances that cost $300,000, $70,000 cot systems, $40,000 cardiac monitors, and our vehicles log over hundreds of thousands of miles in just a few years. We need a dedicated grant fund which is equal in scope to the fire departments. And most critical, EMS lacks a representation. EMS is dying because we don't have a seat at the table. That's got to change. EMS professionals are trained, certified, and essential. We deserve representation like any other public safety brothers. Let me be clear, this is not a budget issue. It's a public safety emergency. This is not about money. This is about life and death. When EMS fails, people die, not because help wasn't willing to come, it's because they couldn't afford to come. We are calling on Governor Shapiro, the state lawmakers, the insurers, and local leaders to act now, not later. This is a bipartisan issue. Lives are at stake. We are asking for 5 critical reforms: fair, realistic, and consistent insurance reimbursements for EMS services. Protection for patients through fair out-of-pocket limits and billing protections. Dedicated and consistent municipal and state funding to support emergency readiness. A standalone EMS grant program that is equal, and policy reform that elevates essential EMS services as it is codified in law. We need a voice. We need to be able to reach out and save people's lives. No Pennsylvania should wonder whether help will arrive in their hour of greatest need. It's time to stop taking EMS for granted. It's time to take our words with action and legislation and investment. Standing behind me is dedication. Standing behind me is compassion. These people are here not because they're trying to protect their jobs. They're here because they are trying to protect the patients of Pennsylvania. We have created an environment in Pennsylvania where there are gaps in care. There's gaps where people are waiting 50 minutes for an ambulance to arrive. We've created situations where people are dying because no ambulance is showing up. That has to change. Thank you. I would like to introduce Representative Martin Causer. He's representing the rural PA Northwest, but more importantly, he's also a certified EMS provider. He can speak to the heart of what's truly going on in the rural Northwest of Pennsylvania.
Thank you very much, Gary, and good morning, everyone. It's great to be here with you this morning, and I want to thank the Ambulance Association of Pennsylvania for their ongoing advocacy, and certainly thank all the EMS personnel, those that are here and those that want to be here and wish they were here, for their commitment to this increasingly challenging work. I have the opportunity to wear a couple different hats, both as a state legislator and also as an EMS provider. As an EMS provider, I'm proud to serve as a volunteer EMT and a life member of the Port Area Ambulance Service in McKean County. We're a small rural ambulance service whose service area has doubled from serving 3 municipalities to 6 municipalities in just over the last year. That's over 300 square miles of territory that we serve. And we do that with 1 crew. We have 2 ambulances. We only have enough money to have 1 crew on duty at a time, and then if a second call comes in, we have to rely on volunteers to come and answer the call to answer the second call. So and then in addition to that, we have mutual aid calls, so we're serving a very large area. Unfortunately, over the last year, we've seen 2 EMS agencies go out of business in McKean County, and as Gary said, over 50 agencies in Pennsylvania in the last year, and it's alarming. When we say that our EMS system is in a state of crisis, I say that we're beyond crisis. We have a major problem in this state with answering the call. In our service, we have 15 active ALS and BLS providers, a mix of career and volunteers, who last year answered 1,027 calls for service. And the calls continue to increase. On top of all that, hospitals in rural Pennsylvania continue to reduce services. In the northern tier of Pennsylvania, we have a 7-county region with no labor and delivery services. Imagine that, 7 counties where you cannot deliver a baby. And that's putting even more burden on our EMS services. We have made progress on many of these issues, but the challenges that EMS are facing are great, and we have much more work to do to save our EMS systems. Let's talk about some of the issues. Reimbursement. These services deserve fair reimbursement for the service provided. In my time in office, reimbursement rates have been increased 3 times, most recently last year when we tied the rates to Medicare rates. I've sponsored House Bill 857 that would help EMS agencies by ensuring that they're reimbursed for Medicaid calls in which treatment is provided, but the patient is not transported to a hospital. Not just what insurance companies think is a reasonable cost. EMS care is so much more than simple transportation. There's a cost for time, supplies, equipment, and expertise provided on every call. And then there's financial support from municipalities, which is critical. And you're going to hear today about the cost of readiness, the cost that it takes to have a crew and equipment, personnel available to respond to an emergency at a moment's notice. The cost of readiness. Well, the cost of readiness in rural Pennsylvania is extremely high. In my area, we created an EMS task force to educate municipalities on the need to provide financial support, and I'm happy to report that we've made progress. When I said earlier that we serve 6 municipalities, all 6 of those municipalities are providing financial support. But that's not the case across the state. As Gary said previously, only 28% of municipalities across the state are providing some financial assistance. We need all of our local municipalities to be providing financial support to their EMS agencies. Our voice needs to get louder and stronger. Over the last 2 years, with over 50 agencies ceasing their operations, the question reoccurs, where is the sense of urgency from state government? The governor didn't even include any new money for EMS in his budget proposal for the next year. There are several of us in the legislature who are pushing for solutions. EMS is too important to be buried 5 layers deep inside the Department of Health. This week, I'm introducing legislation that would create and establish the independent office of EMS Commissioner to operate within the Department of Health to elevate our voices and actually have a seat at the table. This person would directly report to the governor and would effectively elevate and strengthen our voices as we work to stabilize EMS services in the Commonwealth. Today is a call to action. We have to act to keep these vital services in our communities. I look forward to working with all of you and my colleagues in the legislature to save our emergency medical services agencies across the Commonwealth. And again, I thank our EMS professionals for all the work that they do every single day. Thank you very much.
Now I'd like to introduce Matt McKnight from Fayette EMS. Matt comes from the rural and urban areas of southwestern Pennsylvania.
Good morning, everyone. I appreciate everybody showing up today. My name's Matt McKnight. I'm the Assistant Chief of Fayette EMS, again from southwestern Pennsylvania. And Fayette County tops the list, along with our neighbors in Greene County as being some of the poorest counties in the state. I'll quote my boss, Rick Adabata. In 1984, there were 38 ambulance services based in Fayette County. Today, there are 4, 2 of which are volunteer. My service covers 95% of their calls. On June 30th, there will be 3, as the Point Marion Volunteer Fire Department Ambulance Service will relinquish their BLS ambulance license. They're striving to maintain a QRS service. However, those 5% of calls that they covered and transported mean the difference in the availability for the rest of the residents of Fayette County. And now the 6 communities that we cover in Greene County, their sole paid ALS provider suddenly closed their doors in October of 2024, leaving Fayette EMS and a Washington County service to hold the bag. While the numbers in these communities are not staggering, they continue to stress Fayette EMS and the ability to serve the communities that we cover with little to no municipal support. House Bill 1512 will help us to add to one piece of the financial pie that we are missing and enable us to continue to provide high-quality service to our communities without increasing our financial needs from the communities we serve. We do urge legislation to add patient protection to this bill to shield the patient from increased cost sharing for the insurance companies. While House Bill 1512 will help your local EMS, we still urge our communities to help us support through annual fund drives and subscriptions, as well as supporting us through legislation and support sustainable and dedicated financial assistance. Thank you.
Now let me introduce Tim Hinckley. Tim is representing VMSC from from Philadelphia, which is southeast urban and rural areas.
Good morning. Emergency services across the Commonwealth are facing unprecedented changes, resulting in the closure of numerous stations statewide. These closures are posing an imminent threat, and in southeastern Pennsylvania, we've recently seen that in the Chester County region. With increasing financial strain, staffing shortages, and limited funding, EMS agencies are struggling to maintain operations. In the last 29 months, 52 ambulance services, as you can see, have closed and leaving no longer coverage in those areas. My own former station, an ambulance service that served the community for 90 years, had to cease operations in 2024. A deep-rooted organization such as that will show you how fragile our EMS system is when they lose their ability to continue to service. EMS leaders across the Commonwealth are reaching to our legislators, both local and our municipal governments, to swiftly act for funding relief, workforce development programs, and policy reforms that stabilize our emergency medical services. Throughout this great Commonwealth, the EMS is an essential service, and our citizens deserve better. We as the industry are advocating for a statewide fee schedule that will provide consumer protections and service demand on the municipal funding, less service demand on our municipal funding. House Bill 152 supports that effect, and we're asking for bipartisan unity to bring this bill to a vote and approval. More EMS stations closures put more Pennsylvanians at risk. We can do better than this. Thank you.
Thank you. I just want to wrap things up. As you've heard, EMS is in dire straits. We're built on a business model from 40 years ago where insurance reimbursement was expected to make EMS self-sufficient. The problem is it's a failed system. It's a failed system in the fact that if it was a business model that you were going to a bank to try to apply for a small business loan, they'd deny the loan. Why? You got to be available 24/7. You have to be out the door within a minute of somebody calling you. You have to go provide the service, and you have to provide exemplary service. And not only that, you have regulations, you have expensive equipment, expensive ambulances, and then somebody else gets to tell you what they're going to pay you. They get to make that decision. It's a business model set to fail, and it is failing, and you're seeing the results now. Like I said before, we're not asking for a huge budget lift. What we're asking for is legislation that will make emergency calls, because we can't screen people, we can't refuse care, we can't deny service, but we have to have a reasonable expectation when we go out the door that this is what we're going to get paid to provide that service. Lastly, what we need is municipal support. We need somebody to pay for that cost of readiness. We need somebody to pay for the ambulance services to be ready to go out the door 24/7. Services are failing left and right, you've heard that. And in my service alone, we cover 430 square miles of primary coverage area. And in addition to that, 30% of our business is outside of our coverage area because we're forced to go to areas where mutual aid is needed. 30%. Our areas are suffering because we're going into other areas and we're traveling 50 minutes to get to some of these areas to provide care. And I will tell you, as I'm standing here, there are people who are dying because of that delay. It can't happen in 2025. It's totally unacceptable. We ask for your help. We ask for your support. Thank you.